and we have decided to do the topic of Lewy body's disease in dementia. So what we have is we have a patient named Maria Gonzalez. She's 65 years old. She has memory loss. She has hallucinations. She feels delusional sometimes. She has a hunched posture as well. And when she walks, she tends to shuffle. So we're going to be examining her symptoms and what we believe she has. So we looked into it, and we believe that Miss Gonzalez might have LBD, which is Lewy body's dementia, because of the symptoms she has previously mentioned of having memory loss and the hallucinations, and her muscles are becoming weak, and she is old, so it tends to happen more so in older patients. And we decided that we will be conducting brain scans for her, so we're going to do an MRI. Although we did find it is more of a clinical diagnosis, we believe that seeing more deeper into her brain will actually be sure that that's what's going on with her, and that we want to be sure that we diagnose the patient correctly and see how her motor disabilities are kicking in, and possibly see if she does have Lewy body's disease. So with Ms. Gonzalez, we are going to conduct the MRI scan, and with Lewy body proteins in the brain, we can see that there is more of a cluster of mass forming, so we can definitely be more sure of that.
Now we're going to evaluate the various types of imaging available to us in order to determine what would the best decision be for Ms. Gonzalez. The types of imaging that would not work for this patient prior to initial brain scan are the following: X-ray, CT, ultrasound, and PET, and here's why. So first, let's start with X-rays. X-rays are high-energy electromagnetic radiation that penetrates solids and ionizing gases and produces a two-dimensional image of a body region from a single angle. We wouldn't use X-rays for this patient because they are best used in visualizing hard body structures such as teeth and bones, and we need to inspect the brain. In addition, X-rays can damage cells and initiate changes that lead to cancer due to this intense radiation associated with it. On to computer tomography, other known as CT. CT scans take the X-rays as described, but utilizes computers to analyze several cross-section scans to visually represent detailed depictions of bodily structures. We wouldn't use a CT scan for this patient because they are primarily useful in displaying damage from small strokes and subtle ischemia in the brain and other soft tissue scanning, whereas we need a clear depiction of the brain that would help us see if there are any masses developing. Also, due to the use of an axial tomography scanner that rotates as the patient lies on a motorized platform, which provides a 360-degree view of the scan area, patients are exposed to extremely high levels of radiation, and this would be unnecessary exposure for Ms. Gonzalez. Now on to ultrasound. So, ultrasound uses the transmission of high-frequency sound waves into the body to generate an echo signal that is concentrated by a computer into a real-time image of soft tissue structures such as the heart and blood flow, gallbladder, and fetal and growth development in the uterus. We wouldn't use an ultrasound for this patient because these scans aren't used to inspect the brain other than in babies whose skulls haven't completely formed or invasively during surgery directly on the brain itself. It is also significant to note that there are no health risks such as radiation associated with ultrasounds. And lastly, position emission tomography, other known as PET. PET scans are the use of radiopharmaceuticals, which are substances that emit short-lived radiation, other known as a tracer, to show both normal and abnormal metabolic activity in a multitude of conditions, including heart disease, the spread of cancer, certain forms of infection, and brain abnormalities. We wouldn't initially use a PET scan for this patient because we aren't entirely sure what type of dementia Ms. Gonzalez is experiencing. PET scans would help us see the metabolic activity of the brain, but for now we're just trying to get an idea of what's going on. Additionally, PET scans have no health risks, such as radiation or complications with the tracer, if the patient receiving it is not allergic to any of its ingredients. So, After this analysis of the types of diagnostic imaging techniques we have available, we have decided to go with MRI, and here's why. Magnetic resonance imaging, other known as MRI. MRI scans use magnets and radio waves to visually represent, with high precision, nearly every part of the body with incredible precision and clarity. MRI exposes magnetic fields and focused radio waves to the body which emit radio signals without exposing the patient to any radiation. These radio waves manipulate the magnetic position of the atoms of the body, which are picked up by a powerful antenna and sent to a computer. The computer then performs calculations resulting in clear, cross-sectional slices of the body. These images can be converted into 3D pictures of the scanned area, which gives us a perfect view of the brain. In relation to the patient, these scans are especially useful in detecting the following in the brain: cysts, tumors, bleeding, swelling, developmental and structural abnormalities, infections, inflammatory conditions, or problems with the blood vessels. So we'd be able to identify if there are abnormalities in the shape of the brain that would help us pinpoint the diagnosis and or lead us to taking PET scans for confirmation if there are in fact abnormal clumps of protein stemming from LBD. Also, at times an MRI can provide clear images of parts of the brain that can't be seen as well with an X-ray, CAT scan, or ultrasound, making it particularly valuable for diagnosing patients' problems with the pituitary gland and brainstem. Here's what some MRI brain scans would look like with patients that have various types of dementia.
Due to the findings of her primarily scans, we are going to suggest Ms. Gonzalez get a SPECT or a CT scan along with the MRI scan. This is because SPECT and CT scans aid significantly more in diagnosing LBD because they can see brain function, where MRI can just see the size and shape of the brain. But the MRI still is significant to diagnosing LBD because symptoms of LBD such as confusion, lethargy, and hallucinations, they're consistent with different causes of brain damage such as tumors and lesions. So most commonly what we see in LBD patients is atrophy of the brain or shrinkage of the brain. This is caused by the dying brain cells, but not only can we see if there's any shrinkage or atrophy, we can also determine how severe and how long the patient has had LBD. In conjunction with this, we can also rule out any tumors, lesions, any other brain damage that could be causing these kind of vague symptoms when it comes to brain damage. So with the SPECT and CT scan, they're used in conjunction to aid in the LBD diagnosis. The SPECT scan can show abnormalities at a cellular level, and CT scan would narrow down the location of these abnormalities. So dopamine is what stimulates the body movement in the brain, and patients with LBD are deficient with dopamine. So we would be the scans will be able to detect any changes in dopamine transmitter in your brain that allows your brain cells to take in dopamine. So the lack of dopamine is what our patient is complaining about. The muscle aches, the weakness, these are all symptoms described by our patient. So we would be able to test the dopamine transmitter or detect any abnormalities with the SPECT CT scan. And the PET scan helps us see the metabolism activity of the brain. Patients with LBD who experience hallucinations, such as the ones reported by our patient, have less brain metabolism or decreased brain metabolism in the occipital lobe, which is the visual part of the brain, so which could explain why she's experiencing these hallucinations. So really, diagnostic imaging is making a really big difference in the world. I really don't think we would be where we are. The technology is really advancing in the medical field, and I really don't think we'll be able to create the diagnosis that we can without medical imaging. It is impossible to diagnose brain conditions without medical imaging. The brain is the control center for the whole body, so one thing going wrong in the brain will throw off the entire organism. It is very difficult to diagnose brain disorders or disease or damage because the symptoms can really show up on any part of the body. So when a patient complains of a body ache or a limp, this could be because of the dopamine deficiency as we saw with our patient, not due to like a muscle damage or bone damage. It could be, coming from the brain, and we wouldn't know because if we didn't have any brain imaging. Diagnostic imaging also reveals diagnostic imaging makes a life or death difference and helps us see abnormalities, concerns non-invasively, both in the medical and forensic field.